Neuralink Challenger, world-first brain-spinal implant helps paralyzed patients walk. China's neural bypass technology restores nerve function, challenging U.S. dominance in neurotechnology. For decades, paralysis from spinal cord injuries has been seen as irreversible. Even advanced brain-computer interfaces, BCIs, like those developed by Elon Musk's Neuralink, assume that paralyzed limbs are beyond saving. But a groundbreaking clinical trial in China has challenged this notion. Researchers at Shanghai's Fudan University have successfully enabled 4 paralyzed patients to regain control of their legs just hours after undergoing minimally invasive surgery. The trial involved implanting electrode chips in both the brain and spinal cord, re-establishing communication pathways that had been lost due to injury. The results were astonishing. Within 24 hours, the patients could move their legs again. Within weeks, they were able to walk independently. Some even reported restored nerve sensations. Brain-spinal interface's neural bypass overcomes paralysis. Unlike traditional BCIs, which rely on external computers to control movement, the Chinese team's brain-spinal interface works by directly stimulating dormant nerves. This process, known as neural remodeling, allows the nervous system to rewire itself, potentially eliminating the need for lifelong assistive devices. Lead researcher Jia Fumin from the Fudan Brain-like Intelligence Science and Technology Research Institute explained the significance of the achievement. In the past, everyone was familiar with high-end medical equipment from abroad, but now we have entered uncharted territory, achieving the world's first new generation of original brain-spinal interface system solutions, Jia said, as quoted by the university's website. Procedure involves implanting 2 tiny electrode chips, each about 1 millimeter in diameter, into the motor cortex of the brain. These brain-spinal chips collect and decode neural signals and then send precise electrical stimulation to the spinal nerve roots, creating a direct communication link between the brain and paralyzed muscles. The first volunteer, a 34-year-old man who was left paraplegic after a fall, underwent surgery on January 8. Within 24 hours, he could lift both legs. By day 14, he was stepping over obstacles and walking over 16 feet, 5 meters, with a standing frame. 3 other patients underwent surgery in February and March, all showing significant recovery within weeks. Faster recovery compared to previous research. Previous research on neural remodeling, including studies in Switzerland, showed similar effects but only after 6 months. Chinese approach has drastically reduced this timeline to just 2 weeks, suggesting a more efficient method with minimal surgical damage. The first patient's follow-up visit in late February provided further proof of the procedure's effectiveness. My feet feel warm and sweaty, and there is a tingling sensation. When I stand, I feel the muscles in my legs contracting, the patient reported. He also regained sensations that signaled when he needed to use the toilet, indicating deeper nerve restoration. All the medical devices used in these surgeries were developed in China, marking a significant step in the country's advancement in neurotechnology. With 3.74 million spinal cord injury patients in China and 90,000 new cases annually, the impact of this technology could be enormous. If we implant a spinal interface and combine it with 3 to 5 years of rehabilitation training, the patient's nerves can reconnect and be reshaped. Ultimately, we may free patients from device dependence, Jia said, as reported by South China Morning Post.